We're thrilled to have Dr Lindsey Thomas with us today. With 17 years of experience as a GP, Dr Thomas has a specialist interest in peri-menopause, menopause and all aspects of women's health. For the last 11 years, she's been a dedicated GP at Porterbrook Medical Centre. In this episode, we delve into the crucial topic of menopause, a conversation that, thankfully, is increasingly entering the workplace. We'll explore why Dr Thomas is so passionate about this subject, what dental professionals should know when treating patients, and why practice owners should care. We'll also discuss the impact of menopause on the workforce and how dental practices can create a supportive environment. Hello, thank you very much for joining us today.
Thank you for having me.
I'm excited about this one.
And I think it is an exciting. Well, I obviously think it's an exciting topic. So any opportunity to talk about it.
I think it's. I mentioned to you earlier. It's a topic that I'm sure you can talk to us a bit more about this. But it's definitely becoming more of a conversation in everyday life. But I think within dentistry in particular, the menopause is something that practice owners, dental professionals are starting to talk about. And I'm really excited to talk to you to find out how people can feel empowered to have these conversations and why they're important. I think most crucially is why these need to be had within dentistry. But I mean, first of all, let's start with you. Tell us a little bit about you, who you are and what you do.
So I'm a GP and I've been a GP for over 20 years in Sheffield. So I trained in Sheffield and like lots of Sheffield medics stayed and have never left the drawer of the Peak District or something like that. And I've always had I think I've been very lucky in my career. I've worked in two really lovely practices and general practice really lends itself to having a really varied career. So I've been able to develop a specialism in women's health, which I've always really enjoyed. I loved it when I did gynecology as part of my training, but also education. And more recently, I've been able to focus much more on those areas rather than sort of broader general practice. So I do a little bit of general practice now, but mainly menopause and women's health work. So I work in an NHS menopause clinic in Leeds, and I work privately as well for Myla Health. And that's been great because I've never worked privately before. That's only been within sort of the last 3 to 4 years. And that's allowed me to develop other areas. So doing sort of workplace training for menopause awareness. So that's been really good. And then I've always been involved in education. I've been a GP trainer. We have medical students in the practice. But I have become a menopause trainer for other doctors and clinicians who want to specialise in the menopause. So yeah, it's varied and really enjoyable.
Weird question. Why the menopause? How is this something that you thought, this is a conversation and a topic that I feel really passionate about? What is it about the menopause that you feel is so important?
And I think I think I get asked that question a lot and sort of think, how did this become the thing that I've specialised in? But I think probably because I am I do really love women's health anyway, so naturally patients book in to see you. And as a female GP, it's a good job that I like it, because you don't really have any choice. But I think over the last sort of, as a GP, you tend to, if you stay in the same practice, your patients grow up with you.
Yeah.
So women who I had looked after when they were younger and needing contraception and having their babies and doing all of that were suddenly coming into this other stage of life and developing symptoms which probably I wasn't recognising and my colleagues weren't recognising as being perimenopausal or menopausal. And my friends also started to be at that stage of life. And I think I just realised there were big gaps in my knowledge. So I started as a GP just before, and I talk about this as though everyone's aware, but I think there is a general awareness that sort of in the early 2000s, there were some big, HRT was quite freely prescribed up to that point. Some big studies came out that looked as though HRT was really very risky in terms of breast cancer and heart disease. Now, we've got a very different viewpoint on that now, but prescribing literally stopped overnight. So when I first started, I was prescribing and literally all just stopped. And that was internationally as well. If you look at sort of prescribing rates, they just plummet. So I didn't really have any experience in prescribing HRT. None of the people who trained me particularly did either. The sort of older I am the older member in the practice now, but who were the older members in the practice. I couldn't turn to them to ask for advice really either. There was one great female GP in the practice who still had carried on doing quite a lot. So it was really helpful having her.
Right,
But there was just this big gap in my knowledge. And over the last sort of 6-7 years, I suppose that's how I've developed that as a specialism.
I think what's interesting about you as well is you mentioned your husband is a dentist.
Yes, he is.
That lends itself quite nicely to the conversations that we're going to be having. And I think we're going to come at this from all kinds of angles. But I think a really good place to start would be, why should dental professionals care about the menopause? Why is this conversation something they should care about?
So I think the prime reason that it's important to everyone, not just dental professionals, is that everybody born female is going to be menopausal at some point in their lives. And that is 51% of the population. So it's huge numbers of women. And we know that 3/4 of women will find their symptoms quite difficult. We know that a lot of women sort of enter into the perimenopause and menopause and find things more difficult than they thought they might do. And what we traditionally think of as the age that women will become perimenopausal, menopausal, sort of 40s and late 40s, 50s, although I'll talk a little bit about that, but late 40s, 50s. It's the biggest growing demographic in the workplace. So we've got huge numbers of women millions of women in that demographic. So it's really important, not just so that women can be supported and have really, their lives on a struggle with those symptoms that they might be dealing with, but also because economically we really need to, support and help these women to stay in the workplace.
Absolutely.
But also, although we do often think about the menopause as being women in their late 40s and 50s, often just women in their 50s actually is what people think about. But it can start.
In all honesty, that's what comes to mind for me. And I've obviously got a lot to learn. But that is what you kind of associate with it.
So the average age the menopause is just one day in time. It's when someone's periods have stopped for 12 months. So actually, you can't even make that diagnosis. You can only make that retrospectively.
Yeah, absolutely.
So the changes that are going on before that, when the ovaries are not functioning quite as they used to, hormonal production is a bit more haphazard, periods might be changing. That's the perimenopause.
Okay.
And that can happen anywhere between sort of 5 to 7 years before periods stop.
Okay.
So we class anything over 45 as being a normal time for periods to stop. So we need to cast the net a bit wider and look at sort of early 40s, late 30s for some women. But also, some women will have a menopause much earlier than that. So that's looking at a very sort of average natural menopause, for want of a better word. But some women will have surgical menopause, so will have their ovaries removed for things like endometriosis or cancer treatments. A lot of breast cancer treatments involve treatments that are going to massively reduce estrogen levels or turn the ovaries off, so that's another area. And there is a condition called primary ovarian insufficiency, where women can just spontaneously become menopausal under the age of 40. Yeah, and it's not massively common, but it's 1 in 100 women under the age of 40 and 1 in 1,000 under the age of 30. So it's not tiny numbers.
No,
so we do need
1 in 100 in particular. That seems quite. I mean, if
Yeah.
you use that statistic in a situation which would be, like, would you, I don't know, take a risk and you'll lose all your money in your bank account if you press this button? There's a 1 in 100 chance it will happen. Most people would probably say, no, I'm not going to.
Yeah,
It's quite high.
absolutely.
Yeah.
So it is worth this. That's why there needs to be a conversation, because it is going to impact on everyone born female, and that might be at an earlier age than we anticipate.
Absolutely. I think we're going to come at this from sort of 2 angles here. So obviously we've got the patients that dental professionals will be seeing, and we've got the staff members who will also be going through. Yeah. Actually, the majority of dental professionals will go through, because the majority of dental professionals were born women. So that's becoming an increasing conversation because of that. Dental nursing, dental hygiene and therapy is large majority women, but even dentists now as well. It's more women than men.
When you look at the breakdown, it's over 90% of dental care professionals are female, and over 50% of dentists are female. So it's huge. It's a massively female-dominated workforce, and I think a third of the non-dentist staff are of that demographic, sort of 45 to 55, and about 40% of dentists are as well. So that's why it's such an important conversation to have.
Absolutely. I think if we start with the patient side of things, again, this might sound like quite a sort of basic question, but I think it's important to start here is, what are some of the actual oral symptoms that could be picked up by dental professionals that could indicate that a woman is peri-menopausal or going through the menopause?
So there was a really positive survey done, I don't know when it was quite done, but which showed that when dentists were surveyed, they actually had quite good knowledge of what the menopause was and what symptoms might be, but actually didn't have that good a knowledge of what the oral symptoms might be. Now, obviously, that's not going to apply to everyone, but there are so many symptoms that go unrecognised which are related to the menopause, and we can often think about it as just being hot flushes and night sweats. 25% of women will never have those, but there are all sorts of weird and wonderful symptoms that we think about, sort of itching skin, tingling in fingers, things like that. And oral symptoms aren't focused on very much either. But they are about 70% of women will have some form of oral symptom over the age of 50, which could or could not be related to the menopause, because obviously ageing plays a part in that as well. And dentists are so well placed and will be brilliant at picking up oral health conditions. I've always been really, and maybe because my husband's a dentist, but I've always been surprised that patients will come to the doctor to see their GP with problems in their mouth rather than their first port of call necessarily being the dentist. And I'll always always recommend, actually the best person to see about this is your dentist, because they're most skilled in that, picking up oral cancers and signs of other conditions in the mouth, vitamin deficiencies, things like that. And the menopause is no different, really. So the oral mucosa in the mouth, it's not identical to the vaginal mucosa, but it does share some similarities. And we know that, I think we're all aware that lots of women will have vaginal or vulval problems. So we need to think about that sort of shared similarity between the mucosa. So the most common symptoms that dentists will see are dry mouth, which is incredibly common. And we know that saliva production or stimulation of saliva to food when it's needed can reduce, so flow rates can reduce, and the problems that brings with it, not just in mouths feeling uncomfortable, but an increased risk of infection. There can be a change to the bacterial makeup of the mouth with lower levels of estrogen, and obviously that brings with it its problems. Burning mouth syndrome is common, and I think we haven't appreciated quite so much that link with the menopause and lower estrogen levels. But when it's been looked into, not only do some women respond really well to hormone therapy in terms of that symptom, but women have been found to have lower levels of estrogen than those women who don't have burning mouth syndrome. And that can be really debilitating.
I can imagine.
Yeah. So dentists will be really familiar with that, but often there isn't an awful lot to offer or suggest other than, you know, avoiding certain foods, staying well hydrated, some forms of medication, because the estrogen, the drop in estrogen can affect the mouth and the tongue directly, but it can affect it indirectly through sort of nerve pathways. So some medications that we would traditionally use to sort of treat nerve pains might be treated in that situation. But it might not be recognised that actually hormone therapy might be really helpful for those women, because for the vast majority of women under 60, the benefits far outweigh any risks. And it doesn't mean that women over 60 can't have hormone replacement therapy. It's just a slightly different risk-benefit ratio. So dry mouth particularly, burning tongue, burning mouth syndrome, and then the periodontal tissues as well. So all of that support for the teeth can be affected.
God, it affects the whole body, doesn't it?
Absolutely.
I mean, it's quite, I hope this has come across as weird, but it's quite fascinating how it manifests and how it can, you know, you kind of associate it with a certain part of the body. At least I do, as somebody who's not medical. But for you, you know, this is stuff that you know that it can manifest in that way. It's really interesting to know, and I think also a lot of patients won't know that either.
Absolutely. Right? And you're completely right, because we think about it, because it is a female issue and because it is the ovaries where the hormone production has stopped or is reducing, we think about it as being a gynecological issue, whereas actually most of the symptoms that women get are affecting other areas of the body. So if we think about hot flushes and night sweats, which we're all very familiar with, that's from the temperature regulation centre in the brain. So it's nothing to do with any of the pelvic organs. So it is that impact that estrogen has throughout the body. So we know that inflammation can rise all over the body with lower levels of estrogen, but that can impact periodontal inflammation and the bone density in that area. So the sort of alveolar bone, which keeps the teeth well supported and in place. I don't want to be any dentist listening to this can roll their eyes that I've now got that wrong, but roughly the bone density we know reduces in women. There are things that can be done to try and compensate for that, sort of a good diet, vitamin D, supplementation, a calcium-rich diet, and for other areas of the body, doing exercise to strengthen bones. But there is an association with osteoporosis in the rest of the body and bone density reducing in those tissues. And when you compare women who do have lower bone density in other areas, one of the big studies that was done in the early 2000s, where the sort of risks came out of, now that those studies have been reviewed, we have actually got a lot of fruitful information from them. And I think one of those had shown that there was 24% more tooth loss with women who were menopausal and had bone density issues elsewhere. So lots of ways that it can affect the mouth.
And what do dental professionals need to be aware of when it comes to treating menopausal women?
So menopausal women obviously are no different from anyone else,
Of course.
But there are things that might make their treatments more tricky. So I think it's important to have a look. Obviously, dentists will always be reviewing any medication changes when they're seeing someone for a review, and picking up on things which might indicate that this person, they might be on hormone replacement therapy, they might be on breast cancer treatments, which might indicate that their estrogen levels are lower, things like that. And being aware of symptoms which might make dental treatments difficult. So some dental treatments are quite lengthy and you're under bright lights, and often under protective.
It's not fun at the best of times. Any dentist is, I mean, they know because
exactly.
they have to get seen too. But I mean, for the average person who perhaps isn't experiencing these symptoms, it's quite a daunting situation, and there is a crazy amount of people have a fear of going to the dentist. So,
absolutely. So you add into that the fact that someone might be prone to having a hot flush or more sweating, and then add stress into that, which we know is a trigger for hot flushes. And no matter how good a dentist is, like you said, lots of people feel quite anxious about it. So it may be that they're going to feel really uncomfortable and hot and might be sweaty. And someone just being aware of that in that age group of women might be able to, just keep an eye, or the dental nurse keeping an eye that they might need a break, they might need a fan, those sorts of things. And one of the most common symptoms of the perimenopause and menopause can be sort of emotional and psychological issues. So women can notice their anxiety levels increase or feel more easily overwhelmed. So actually you might have a patient who's always coped really well with dental treatments and then finds it actually quite difficult and might need things explaining in more detail, more reassurance. They might need the nurse to be able to offer more support in that situation. So just being aware of those things, and that the patient that because dentists are the same as GPs. I know that my husband treats people who he's seen since they were children. And so that person that you might know and recognise might just respond slightly differently than they have done before.
Yeah, absolutely. What would you say to dental professionals who may suspect a patient may be experiencing symptoms which may or may not be menopausal? As you've already mentioned, sometimes there's a lot of crossover. It could just be associated with something else. How would you suggest they navigate these conversations? Is there a referral practice? Could they start to refer them to, maybe give them leaflets? Is that something you would encourage? Do you think that would be a good practice to integrate into the clinical environment?
So I think that would be perfect, and there's some really good resources out there, because if a dentist has been, and they are in a good position because they often, have been seeing someone over a long period of time. There's quite a lot of chatting one-sided, I would imagine. But if you've opened that conversation, and if they've been able to open that conversation, say, for example, someone is complaining that their mouth has become drier, and they open the conversation of, how have you been feeling in yourself? Have you noticed any other changes at all? Sometimes we see this in women whose hormone levels are changing. It's great to be able to signpost to resources at that point. And that's when it's good to signpost to really trusted resources as well. So I work for, or I'm on the board of a primary care women's health society called the Primary Care Women's Health Forum, and most of our work is around educating clinicians, but we do have a patient arm for the menopause called Rock My Menopause, and there's really good resources on there. It's all very evidence-based. So that's a good resource to signpost to.
Absolutely. Thank you. Moving over to the workforce now. So obviously, you've got patients who may be experiencing these symptoms, but then perhaps just as importantly, you've got staff who may be experiencing these symptoms, and obviously you can't operate as a practice without your staff, as we've established. Lots of women in dentistry. So why is this something that practice owners in particular should be talking about with the staff? Why is that so important?
So I think there's sort of lots of different reasons why, and the first one of those, I would hope, is because we want to have gender and age equality at work, and obviously there is a very skewed gender
unfortunately.
So that's why it's going to be really important. But and in terms of supporting staff feeling better in themselves, being able to flourish at work and thrive in the same way that they always have done, but there are real benefits for employers as well. So we know that, I don't know if I gave this stat before, but about 1 in 10 women will think about leaving work. Lots of women will actively not go for promotion because of how they feel. They'll look to reduce their hours. And there is significant sick leave associated for women who really are struggling, perhaps particularly in an environment where they don't feel that many adaptations can be made to their job to support them. But we can talk about ways that dentists can think about that. And dentistry at the moment, and I don't think that where I live is unique to that, recruitment and retention of dental nurses can be tricky.
It's an understatement.
Okay.
No, you've hit the nail on the head there. I know you probably, maybe your husband talks about this when he obviously sees that on a day-to-day, but that's a huge issue.
Well, I know that in Dave's been a dentist for as long as I've been a GP, but in previous years, I don't remember him being as concerned. Oh, and obviously, he doesn't want to. He wants to hold on to staff.
No, I know what you mean. He doesn't. You don't
when
remember
a
it being
nurse
such
was leaving, or just decided she was going to do something, or he or she was going to do something else. It wouldn't have been such a pressure. Whereas now, I think there is, and he is very lucky. They have got a really good retention of staff, but anything that can be done to try to keep hold of and support staff is really important. So having things in place to help female staff who might be going through that transition, whether it's therapists, nurses, receptionists, dentists, is really important in terms of reducing sick leave, improving retention of staff, but also recruitment, because I've seen from working in other organisations that actually it's becoming really attractive to have a menopause policy in place, or even any sort of menstrual work policy in place, because women know that it's a positive, they're going to be well supported. And I think it sets out not just in terms of them necessarily needing that support, but what sort of employer you're going to be working
I mean, workplace such a huge part in your life. You want to be happy and feel comfortable, and if you're going through something that's making you not happy and not comfortable, it's nice to see that it's reflected in your workplace, that people are making an effort to improve basically both of those things. And I think what's really interesting there is, you said you should care. For starters, we should all care about this, but if you don't, I mean, maybe take a little bit of a look at yourself first. Personally, I was going to say that, but there's an economic benefit to introducing these types of things as well. And as you've just said, not only is it important for the personal development of the dental professional, but it's good for the business.
Absolutely. And I think for small businesses, which, and dentistry is a real melee of that at the moment, isn't it, of big corporates and smaller independent, it can seem like quite an outlay to be, sort of funding menopause awareness programs and support and putting policies in place. But actually, recruiting and retraining staff comes at a huge cost. So actually, any cost that comes is normally the benefit of that is normally
100%.
reaped many times over.
Yeah, even if it isn't, you don't directly see it. It's not going to be a quick overnight. I can see exactly what my return on investment is from doing this. Yeah, but it shouldn't be underestimated to feel valued and cared for in your workplace. Is you can't really put a price on it, and when you're, particularly as a woman, I think, not everything, well, that's an understatement again, but things are working against you a lot of the time. And we all know that many environments, many things in life, I think my mum told me the other day, and again, I don't know how true this is, so don't hold me to it, but even crash dummies, when they test cars, they're male. They don't do them on female dummies. I mean, it wouldn't surprise me, sadly, but things like that, we all know that it's a man's world still, and we're working towards making sure it's everyone's world, but it is still, that can't be denied. So to know that your employer cares and is there to make you more comfortable is really powerful.
And I think as well, dentistry is quite a unique setting in that everyone works very, very closely together. So, the relationship between dentists and their nurses, it's a very close relationship. So if someone is feeling really irritable or are really struggling with their mood or, those sorts of things, that can be really tricky in navigating that relationship together. But also for patients, it's a public facing job, and that can make feeling vulnerable or having symptoms very difficult as well, because there's nowhere to hide from it. So I think there's lots of reasons why support is really important for both employees and employers.
Absolutely. What would you say to those dental professionals who won't go through life experiencing any type of perimenopause or menopausal symptoms and may feel a bit uncomfortable having these conversations, may feel they can't, basically, it's not really their position to, or they don't think that they really need to? What would you say to those listening or watching who might be having those hesitations?
So I think what's sad really is that we know, not just in dentistry, in all organisations, that one of the reasons that women sort of step away from work or reduce hours or take sick leave is because they don't feel that they can say why they're feeling the way they're feeling or why they're needing to take time off. And that has also been a real problem. Just looking at the sort of more drastic end of things, that has been a reason for tribunals relating to the menopause, because people haven't felt that they could be open about it and be supported. And I think with anything, any sort of, and you know, the menopause obviously isn't an illness, but with any symptoms that someone's experiencing, you know, how much someone wants to discuss that, it doesn't mean that you need to pry into someone's life, but just, you know, having an understanding of what's going on. And we would do that if someone was really struggling with back pain. We would do that if someone had broken an arm. We do it when someone's pregnant. So I think it's just thinking about it as something which isn't really a choice. It's something that we've got to feel more comfortable with. And I wonder if we don't feel comfortable, not everyone feels comfortable with it, because we do think about it as being a gynecological issue. And if we remove it from that and think about it just being that hormone levels are changing, then actually perhaps people might feel more comfortable.
So reframing it almost in your head, kind of losing the stigma that perhaps is associated with it and looking at it, like you've just said, as more of a hormone, you know, a condition to do with hormones rather than gynecological. I understand. I mean, some could argue that even if it was a gynecological, that could be a conversation you can have anyway. But if it helps, I think anything that promotes, you know, a progressive conversation when it comes to this, you know, whatever works really.
And I think we are really moving forward, aren't we, hopefully, with women's health issues at work. And, you know, as I said, menstrual policies and things like that are becoming much more widespread now.
Yeah, are you seeing that?
In some organisations that we work with, yes. And people are wanting to implement that, because when we look at the impact that some people's menstrual health has on their ability to work, you know, that's enormous as well. And I think just very simple things which we all ought to be, you know, open about. So like you said, even if it is a gynecological issue, it doesn't matter. It's something, you know, periods are something which happen, you know, to most women every month for years and years of their life. So we can't really pretend that it doesn't happen. And similarly, the perimenopause and menopause are something which to varying degrees are going to impact all women. So I think it's just, you know, being, you know, open-minded and not having to feel that you've got to talk about it in huge detail. No one wants, and most women don't want to talk about those things in huge detail. But it just being a conversation that can be had.
I think you hit the nail on the head earlier where you said, you know, that you work closely with your team. A lot of people do in many work environments, but in dentistry in particular, there's a lot of close relationships that are formed in that environment, and just even knowing that a colleague may either be going through something similar to you or may know somebody who's going through something similar to you, and being able to have that conversation could just make such a difference.
Yeah, absolutely. Even just people knowing what's going on and why you're feeling a certain way can make things feel a lot more comfortable. But there are other adjustments which can be helpful in practice as well.
I mean, I was going to sort of segue into that now. I was going to say, what are some practical tips and advice that you can give dental practices when it comes to making reasonable adjustments for people who may be experiencing these symptoms?
So really practical things. Thinking about uniforms, so making sure that they are comfortable and breathable, and that, you know, if someone is experiencing flushes or sweats, that they're going to have something which feels more breathable. They might need more uniforms. If they're feeling, you know, particularly sweaty all the time, they might need to feel that they want to change more frequently. Ventilation. So having fans, and obviously, you know, there are quite a lot of dental surgeries that will have air conditioning, and maybe not in all of the surgeries, but if there is a surgery which has air conditioning, trying to prioritise that for someone who is struggling and needs things to be a little bit cooler. Having rest areas that people can go to, making sure that there are, you know, the perimenopause while women are still having periods can be a time when women unexpectedly get periods and can have really heavy bleeding. So just having the female toilets well stocked with period products is a really easy win, so that's there. And looking at how can you accommodate someone who might feel that they need a bit of a breather from surgery, or that they, on that particular day are not feeling like that's the role that they can play in the practice. And I know that lots of surgeries will have almost a floating individual clinician, and whether that's that they're doing stock taking, whether that's that they're doing decontamination. I've picked all of this up. I've been well primed by my husband. It's
great. I love it.
Or a head nurse who's having more of a supervisory role.
Yes.
And we've talked a lot about nurses. I know there are lots of other female staff in the
of course, but I think we as that dental nurses and hygienists and therapists, they are large majority are female. So it's. Yes, it's a fair comment to be making, but I mean, I guess it applies to the whole practice.
So for them, it might be that if they are feeling that they need to step outside surgery, that there is going to be someone who knows that they might need to step in and do that role. It may be that working hours need to be looked at. Lots of surgeries do late nights, and if someone, or an sort of twilight session, and if someone is struggling with their sleep, which is a really common problem, it might be that they would find it easier to start a little bit later in the morning when they've been able to, get up, come round, get themselves going. So looking at, is there any flexibility in hours? Is there any flexibility in duties? Those sorts of things, and just supporting people to do that. But I think that's where awareness really comes in as well, because actually what we don't want to do is to support people to continue not feeling great.
Yes.
And it's about women having, and anyone born female, having all of the information as to what their options are. How can they best navigate this stage in life? And not everyone will, it's not, I don't ever want the menopause to seem like this really scary and daunting thing that we've all got to look towards. And 25% of women will feel that they don't have any symptoms at all. And of the other 75%, not everyone is going to have every symptom or experience them really severely. So there is that, broadness to how women will experience the menopause. So I think we don't want to have a really negative slant on it, but it's about awareness and knowing that some people might, really struggle to navigate their way through. Other women might find that slightly easier, and trying to accommodate everyone within that.
Absolutely. Is there anything practices can do, like visually, to show that they are an inclusive practice? So I'm kind of moving away from the workforce a bit here and moving back to that patient realm, because I think there's a real lack of attendance in some areas of the UK. I mean, I'm sure you're aware of that. For sure, you get the same when it comes to what you do, and people may not turn up to appointments, and there's many reasons for that. And I guess in this instance, it might help if there was some kind of visual. We are a kind of, I don't know, is there such thing as like a menopause friendly?
Yeah, there are.
Is that something you can do?
People can become accredited and menopause friendly, and that's great. And I think that sort of opens conversations. What I think is really important is that and this is sort of going back to the workforce again, is that if employers are wanting to improve menopause awareness for their staff particularly, that it needs to be more than sort of a tick box. So it needs to be more than we are a menopause friendly, accredited practice, we are menopause friendly. It's got to be, what does that translate into? What does that look like for those staff in terms of manager training? I did a manager training session for the sort of South Yorkshire practice managers. They have a group through HEE, and so I did a session for them in terms of awareness and policies and things like that. So I think it's important that managers are trained, all of the staff are aware, not just those who are going through menopause at that time, but that everyone has that awareness as well, and then there are policies in place to support that. But in terms of patients, it might just be as simple as popping something on social media, having something in the waiting room, those sorts of things. Maybe someone dental would like to produce a menopause leaflet that dentists can give out.
Absolutely. I think that tick box exercise notion that you spoke about there is very interesting, because I think you want genuine change, right? You don't want it to be just sort of, I don't know, I'm looking for a particular phrase now, it's just gone straight out of my head, but for want of a better word, tick box exercise, you don't want it to just be that. I mean, is this something that you feel we see quite a lot of? I'm not talking about dentistry here, just in general. Do you have, is there anything that you see on a day-to-day, like, oh, you're not actually doing anything though?
I think it's really, really varied, probably as with all, things in different organisations are. And I think there are some organisations who are really passionate about it and really want to improve things and retain their staff. I think for others, it is, everybody ought to have a menopause policy in place, and it becomes that. And I think it is difficult for smaller businesses as well, because you might not have, even though you've, lots of female staff, as we've said, they're not all going to be perimenopausal or menopausal at the same time. And I think then in that situation, it's often good for smaller practices to group together and perhaps do their, menopause awareness training and things together. Or what's really good in organisations is to have a menopause advocate, and that will be a member of staff who themselves has put themselves forward to have extra training, to be someone who people can talk to, and they can then signpost to resources and policies and help that's out there. And that wouldn't need to be someone in every practice. That could be someone across practices. And I think that's probably even easier in corporates, because there is a shared, sort of policies and all those sorts of things.
Yeah. For anyone watching or listening who are thinking, right, I'm not doing all of this, what are some practical steps they can take quite quickly, maybe over the next week or so, that can allow them to move towards being more inclusive?
So I would, lots of practices will have practice meetings. It'd be good to put that on the agenda for the next meeting, so that you're opening that up, and maybe, start to have those conversations with women of, female in the workplace of any age, just saying, what do you think? Do you think we're doing this well? Do you think anybody's struggling at the moment? Do you think there's more we could be doing? And canvassing your own workforce as to what they want. I would start to think about what well-being, because, menopause is important, but so is all well-being. What are you doing as a practice in terms of well-being? And could you have sort of a schedule of events that you're going to do? How could that work? I'm sure that the BDA will have things in place in terms of policies that people can use, and making sure, there is a need for things to be watertight, as there are with all sickness procedures. And with solicitors that I've worked with, and at Myla, the company that I work with, we know that, tribunals for menopause are really on the rise. So it's almost a sort of getting ahead of the game before those things are an issue. And hopefully they never will be an issue. But so I think speaking to staff, getting it on the agenda, looking, is that something that people want? Do you want some awareness training in work? What's going to work best for you as an individual practice?
It's nice. Going to the staff rather than saying this is what's going to happen. That is a conversation, isn't it? It's supposed to be a back and forth. What can we do? And actually listening to the people that you employ so that you can best accommodate their needs and comforts, I guess.
Absolutely. And there's been, I won't name them, but there's been some quite famous cases that you might have seen in the news last year, where companies had really got it quite wrong, because someone had gone off on, an idea, and with all best intentions,
of course,
actually then staff had found that quite offensive. So I think it is good to involve staff and
brainstorm
to see
before you actually put anything into place, because, it's a learning. I mean, I stated earlier, I as somebody who will hopefully, because I'll reach the age where I go through something like that, I don't know an awful lot about it. So if I don't, if there's somebody who isn't female, or wasn't born female, it's kind of understandable. There's going to be gaps in the knowledge. So it's isn't something that people should feel, oh gosh, what if I say the wrong thing? Obviously, there's quite an obvious, I personally think quite obvious things what not to do and say. But I think if when you generate that conversation and you approach it with like, I am a little bit ignorant, but I would like to learn and be better. Most people are really open to having those conversations and being able to, they appreciate it. I do, for one, if it's something that people approach me on and they're like, oh, I don't really know much about this, but could you maybe tell me a bit more about it? I find that really a productive conversation.
Yeah. And I did a talk to the LDC in Sheffield, and a young dentist, someone who'd not been qualified for very long, had come up to me at the end and said how he'd felt quite guilty because he gets on really well with his nurse, but there'd been quite a lot of teasing about her menopausal symptoms, and that he'd gone into work the next day. I'd bumped into him, and he'd told me that he'd gone into work the next day and had apologised and had said, look, I really want to try and work in a way that's supportive of you. And even just something as simple as that, can hopefully really improve a relationship and keep 100%. That working relationship going. Yeah. I think in terms of menopause awareness, though, it is also about getting the right people in to help and getting the right information, because there still are quite a lot of myths out there in terms of, in terms of treatments that are available, what the risks and benefits of those are, what options there are for navigating the menopause, what symptoms there are, all of those things. So I think it's good to get, get the information right.
Yeah, definitely. When it comes to the future, you must have maybe 2 images in your head, one of what you would just love to happen, and then one that's maybe a little bit more realistic. What do you, how in a future, maybe a more realistic future, what would the world be like when it comes to these kinds of conversations? Maybe women's health in particular, generally, sorry.
Yeah, women's health in general. I think, there is a huge gender health gap.
Yeah.
And again, just looking at it economically, if we changed that, if we invested in women's health economically, there would be huge benefits. And women do have different needs to men. And you were saying before about the test dummies. Well, the health service is a health service built for men by men. And we need to change that, because women have a lot of, very natural processes, for want of a better word, which are going to, may have an impact on people's lives. And we just need to become really aware of that, really inclusive, really supportive. And women's lives will benefit hugely, but so will everyone around them, because of the many different roles that women play in society, in their families, in care roles. So I would like to see that there's a big investment in women's health, that it really improves, that those sorts of routine maintenance sort of health needs that women have are much more easily met and much more conveniently met for women. So at the moment there is a women's health strategy from the government, which there has been, a pot of money allocated to. Now, money isn't endless, I appreciate that, but it's a relatively small amount of money, if I dare say that, if you look at the scale of the issue. But it's a start. It is being prioritised. There have been, surveys done. There is a women's health ambassador who's been put in roles. So I think things hopefully are moving in the right direction, and hopefully it won't be something that we need to talk about anymore.
Yeah, that would be nice.
There will be equality.
Absolutely. I mean, that's the goal, isn't it, really, where these kinds of conversations that are traditionally taboo, unfortunately, sadly, that's not even something that ever crosses anyone's mind. It just becomes natural to have them. I hope to see that as the future, not just in healthcare, just in general, where we can all just sort of treat each other as human beings, and make the necessary adjustments depending on, that individual's needs and comforts. But it's been so lovely to have you on today. Thank you so much. There's so much that the profession can take away from what you've just discussed, and I think many people would have learned a lot today. I definitely have. So I really appreciate it.
Thank you. I've really enjoyed it. Thanks for having me.
Thank you.